You're muted.
Story of my life. Hey, everybody. Thank you for coming. I was on mute, story of my life. My name is Juan Moore, and I'm the Regional Director of For Our Future Florida. Here at For Our Future, our mission is to mobilize and empower people and community-based organizations to drive real change while advancing our shared agenda. Thank you all for joining our call today. We have some very important people on the Zoom, and at the end of the call, you'll get to ask questions by raising your hands, and we'll call on you individually. First, we're going to hear from Representative Doti Joseph. Representative Joseph represents Florida's 108th district. Born into a life of public service and community activism as the daughter of Reverend Honel Joseph and Marguerite Premier, a nurse, Doti grew up in the district, attended Miami-Dade Public Schools, studied hard, and earned degrees from Yale University and Georgetown Law. Representative Joseph, because of a fierce advocate, became a fierce advocate after interning with the Lawyers Committee for Civil Rights under the law, the U.S. Department of Justice Civil Rights Division, and litigating employment discrimination cases all around the U.S. Wanting to use her advocacy skills to serve the community, Doti returned home to make a difference. In the House, Doti fights for equal access to affordable housing, safe communities, quality education, affordable healthcare, and job creation. Her work in Tallahassee is improving the quality of life for all who live, work, and play in the district. I want to thank you, Representative Joseph, for joining us today, and toss the mic to you. Thank you.
Awesome. Well, thank you so much for having me this morning. Good morning to everyone who has taken the time to join us. Thank you, Juan, for that warm introduction. We just finished week 3 of session up here in Tallahassee. And can I tell you, we are fighting tooth and nail against some of the most divisive, unnecessary, over-the-top legislation I have seen in my tenure. This is my 4th session up here, all while trying to survive a global pandemic. So just this week, my Senate colleagues spent the morning questioning the governor's handpicked Surgeon General. And when asked about whether or not he believed that vaccines helped with COVID, he bobbed and weaved like he was Mike Tyson. It was out of control. And, you know, I'll get into ways that people can address making sure that you get vaccinated later on. But I want to be clear about what the vaccine is. So no, it's not a sterilization vaccine, meaning it does not 100% stop transmission or contracting the virus, but it's over 90% effective in making sure that you don't die. So if for no other reason, then consider it for that. Now, all of that being said, some of the things that we've been dealing with up here in Tallahassee include things like the 15-week abortion bill, which is HB 5. There's the Don't Say Gay bill, like you can't even talk about it in schools, which is HB 1557. And one of my all-time disfavorite, the white fragility incarnate / white supremacist snowflake bill, better known as SB 148, which takes out the curriculum talking about anything that makes white people uncomfortable. I mean, like, I don't even have words. And then the icing on that cake is you throw on, and there's lots of them, right? Is you throw on the governor's blatantly unconstitutional redistricting plan. What is he even doing submitting a plan? I have no idea. It's not his business. But he literally just cut out a whole minority seat in North Africa as far as his congressional plan went. Anyhow, let me talk about some good things that are going on in the legislature. I have a bill out there to decriminalize marijuana and all drugs that make people addicted. And it applies only to the drug addicts so that they can get the help that they need, and a non-criminal civil fine of $50 in lieu of just throwing them away in our overcrowded jail system. This is a bill that's designed to actually save lives as opposed to pretend to care about lives. I also have a HB 1489, which is a reemployment assistance bill. It's a bill that basically tries to fix the bedrock things of our unemployment compensation system, which we've seen how terrible it has been in Florida. The Democratic caucus, have been trying to fix it from when the pandemic began, when we saw how broken it was. It passed last session unanimously out of the Senate. Then the governor decided that he just didn't like it. So it basically got stalled. So we're re-upping that fight to see if we can get some movement to get people the relief that they need. And as far as vaccines go, there's lots of other bills I can talk about. I don't want to waste too much time, but everything from repealing Stand Your Ground to a whole host of things that are designed to reach equity in our communities. If you are in Miami-Dade County and you are looking for where to get the vaccine, I would encourage you to just Google COVID-19 vaccine finder Miami-Dade. There's a website, you can click on it and you put in your zip code, it helps you find it. Same thing for testing. If you're having trouble finding testing, Miami-Dade is great about finding ways to do that. If you're not in Miami-Dade County and you are looking for where to get the vaccine, I encourage you to visit either the vaccine or the booster. You can visit vaccinesplural.gov, or you can text your zip code to 438829, or call 1-800-232-0233. And that's it for me. I just want y'all to stay alive, people. Carry on.
Absolutely. Absolutely. Thank you so much, Representative Joseph. And I'm going to bring up one of our organizers from the Vaccine Hesitancy Program run by HRSA, Darian Borges. Thank you so much.
Thank you, Juan, and thank you, Representative Joseph, for that insight as to what's going on in Tallahassee. Yeah, my name is Darian Borges, and I've been in the front lines here with For Our Future as once that I'm a community outreach organizer. And we have been training, educating, mobilizing residents to get vaccinated. You know, when COVID hit our city, it was plagued with misinformation. And when the vaccine started rolling out, we organized and educated our residents and met them at their door. We're having these conversations one-on-one with people. And as we know, Miami is a very diverse community where for many people, English is a second or third language. Over the last 4 months, For Our Future has spoken to over 18,000 people at their doors or throughout the community. Again, these are one-on-one conversations we're having directly with people. We have also made or spoken to over 3,000 people on the phone with HRSA. Anyone without health insurance, no matter their immigration status, can get vaccinated. There's no social security number requirement or government ID, although it may be requested. It is not required to get vaccinated, tested, or treated for COVID-19. And that's something that's very important for members of the community to know, because again, there's a lot of misinformation saying otherwise. At the time that so many people are struggling to pay their bills, this program is a game changer. You cannot be billed for COVID-19 vaccinations. If you receive a bill, you should first speak to the entity or facility that billed you. And if they don't cancel it, you should contact the Inspector General hotline at 1-800-HHS-TIPS, TIPS, or visit tips.hhs.gov to file a complaint. Because again, you cannot be billed for COVID-19 vaccinations. As President Biden says, we know the job is not finished. There's still a lot of work to do, but we have the tools to protect people: vaccines, boosters, treatments, tests, masks, and more. And because of these tools, we're moving forward to a time when hopefully COVID won't disrupt our daily lives, where we won't be in this constant crisis of COVID, but rather it could be something we protect against and treat. While vaccine requirements for healthcare workers are going into effect, requirements to get federal workers vaccinated resulted in over a 98% compliance. That's a lot of people, 98%. We're adding nearly 9 million more vaccinations each week, and President Biden will continue efforts to reach unvaccinated individuals, help parents get their kids vaccinated, and urge those who are eligible to get boosted. As far as treatments, the US has more effective treatments available in the month of January than ever before. 4 million doses, in fact. And the number will continue to increase over coming weeks. This includes more treatment courses of Pfizer's antiviral pills that the Biden administration got out to the American people 7 months ahead of schedule. And we continue to make tests more accessible for Americans. President Biden's program to mail free tests to all American households, it's up and running. In fact, in the last few weeks on the field, it's one of the things that myself and my colleagues have been speaking to people about. People are really in need and wanting these tests. In addition, we're standing up free testing sites across the country. Increasing manufacturing and at-home tests are now covered by private insurance. While we are seeing the Omicron surge start to recede, thankfully, in some communities, the administration will remain focused on helping areas that are still rising with cases and numbers. More surge response teams will support local hospitals. 4 million N95 masks are going out now as we speak to the American people for free. And we will continue to work hand in hand with school districts to ensure that they have the resources they need. While we're not there yet, the tools made widely available by President Biden are working, and we will continue to make process and get to where we all want to be, all of us. So I now would like to introduce Ms. Stephanie Moore. Stephanie is a working mom, recently got COVID, and she would like to discuss how the Governor DeSantis, reopened schools without plans to protect students, teachers, parents by doing things like losing these mask mandates. So Stephanie.
Thank you, Darian. As he said, my name is Stephanie Moore. I have recently contracted COVID, but thank God I'm alive, thanks to the vaccine. How can I catch COVID as a stay-at-home mom when I don't even go nowhere and I'm vaccinated? Well, I probably got it from my two small children who are 5 and 9. Ever since the school has reopened this year, it has shut down a total of 4 times due to the COVID outbreaks within the school, teachers and students becoming super ill. Why are we still having COVID outbreaks in 2022 at such a large scale? That's because Governor Ron DeSantis prematurely opened up the schools and forced teachers to comply with dangerous tactics, such as no mask mandates in school, attacks on the school districts who did not comply with his demands by issuing fines and salary deductions. Since we're all vaccinated and boosted, luckily my symptoms were little, it wasn't that much. I'm sorry. But we all know that a lot of our brothers, sisters, family members, frontline workers, teachers have been so lucky. Governor Ron DeSantis, we need you to put your ego aside and put the health and safety of Floridians in front of your agenda. Enough of the politics. We need you to be there. We need you to do better. And better yet, we need you to step aside this year and make room for leaders who care. Thank you.
Thank you so much, Stephanie, Representative Joseph, and Darian. Now we're going to open it up for a few questions for Representative Joseph. So if you guys could raise your hand, I will pull you off of mute and you could ask your questions.
Can you hear me?
Yes.
Hi, Rep. Joseph. This is Laura Castles with the Florida Phoenix. I'm trying to keep up with all of those bills that you were just talking about.
Good morning and good luck.
I guess actually, if y'all could talk a little bit more about monoclonal antibody therapies and the fact that Regeneron and Lilly brands have both said they don't work. Biden, FDA halted their distribution, and yet the governor continues to promote those as therapies for COVID. So I definitely would like to see what you all think about that. And is that, and does Dr. Ladapo owe the public some explanation about the differences of the monoclonal antibody therapies and which strains they treat and don't treat? Thank you.
You're almost welcome, because I'm going to try to answer your question. So the Biden administration's goal is to make sure that if an American gets sick with COVID, that they get the treatment that actually works, right? Not pretend work, not makes you feel like you're doing something, no placebo effect, like actually works, right? So the CDC estimates that the Omicron variant right now makes up about 99% of the cases nationwide of COVID. The science is clear that monoclonal antibody treatments don't work against Omicron. They may have been more effective against other variants, but it's just not the case with the one that's prevalent right now. So as you mentioned already, both Regeneron and Eli Lilly have said that their monoclonal antibody don't work against Omicron. The NIH, the National Institution for Health, agrees, and virtually all studies have bolstered that. And I can give you examples if you need them, but I'm sure you probably have the White House's press statement on that. Now, the FDA has restricted the authorization to say that these products are not currently authorized to be used anywhere in the country, specifically because they don't actually work against the variant that we're dealing with. And the American Medical Association agrees with the FDA's decision, saying that we are pleased that the FDA is following scientific evidence and limiting the use of monoclonal antibody treatments to those that are effective against the Omicron variant. So to answer your question about why the governor or the Surgeon General don't advocate for things that are actually effective, as opposed to things that bolster their political narrative, regardless of how it impacts people's lives, I don't know the answer to that. As a lawyer, I'm thinking calls for speculation. You'd really have to just ask them about that, because I don't know. I just want people to live.
Thank you. Do you think that particular issue might come up in Dr. Ladapo's next confirmation hearing, if he is forced to actually answer questions succinctly?
I would hope that my Senate colleagues would include that, and I know several of us are encouraging that. At the end of the day, what it boils down to is just we need people in positions, whether they're elected or appointed, that care about people and not about politics. And you need to be able to put that aside for what we're dealing with, because this is not going to be the last variant that we see. And, in this quote unquote free state, and people who, let me just keep some of my thoughts to myself, but I will say that I would hope that that is something that it is addressed. But as you've seen, when some of my Senate colleagues have asked questions of the Surgeon General appointee, who's acting in that role right now, the answers have been less than satisfying.
Thank you. I have more questions, but I don't want to proceed until others can ask.
Thank you.
Laura, I think you're good to proceed if you would like.
Okay, well, in that case, Ms. Moore, I'm glad that you are feeling better. Did your area have, do you know what the infection rate was in your school district? Because I know that in a lot of cases, the local health departments were very clear that they did not have the capacity to do testing and contact tracing in support of opening the schools. So I think the data has been very difficult to get because there was no testing capacity sufficient. So how would you describe the school district where your children may have been exposed and brought COVID home to your house?
Well, I'm in a Miami-Dade school district. My kids, they actually go to a private school. Um, I know that the numbers were up. I'm not too sure, like statistically, how up were they, but the school had the private school that my kids went to, it had to shut down 4 times because the COVID was so bad that almost all the kids, the lunch ladies, the principal, everyone had contracted it, or if not, been exposed. And so, we had to quarantine, and yeah, it was pretty bad here in Miami-Dade. But I see that a lot of people are now getting vaccinated, especially children. I have advocate that all of my children, I have a 17-year-old, a 16-year-old, and they all are vaccinated and boosted. As soon as they roll out the boosters for the 9-year-olds and the 5-year-olds, I'm going to be the first in line because thank God my symptoms wasn't bad because I'm boosted and vaccinated, and I just will encourage everyone to do the same.
Thank you.
If nobody else has any questions, we could wrap it up.
Awesome. I just want to say thank you to everybody who came out. And you guys be safe out there, please, please, please. Representative Joseph, I wanted to leave you with the last words. If you wanted to let people know, legislative session is open, and so you're going to be busy, but if they wanted to contact your office, where they could do so.
Absolutely. Uh-oh, Jesse's singing for us, boy. You can contact my office at 850-717-5108. Once again, that's 850-717-5108. You can also reach out to me at Doti, that's DOTIE, just how it shows up on the screen, .joseph@myfloridahouse.gov, as well as if you want to hit me up directly, I do check my own IG messages. If you DM me on Instagram, it's just Doti Joseph. And it's session. So usually I get back to people within 24 hours. It might take me 2 or 3 days if it's on IG, so just know that. But those are the ways to get in touch with me. Thank you.
Thank you so much for fighting for us, Representative Joseph. You do your thing out there. And thank you guys for joining us on this For Our Future press event. You guys have a great day, and later, Gators.